Alrighty, Friday, January 22nd, J.R. Lewis with you here on KLAM and KCDV, and a very interesting daily briefing for you. If you are interested in making sure that you're on the list to potentially receive future allotments of COVID-19 vaccine, the city has rolled out a new system for getting you on that list, and that's what we're going to talk about with Dr. Sanders here today. Have pencil and paper or your virtual notepad ready or something like that to take down a couple of important web addresses, which we'll give you at the end of the program, if not during, because I can't remember right now if we actually gave the addresses out, but I'll give them to you at the end after the conversation as we're saying farewell. And these daily briefings, again, in the 1, 5, and 8 p.m. hours on the radio, and then youtube.com/Cordova TV to hear them online as soon as they get updated. So, again, grab that pencil and paper, and we're going to have a conversation with Dr. Sanders about how to get on the vaccine list for today's daily briefing. So, Dr. Sanders, we have a development on the for people to be able to sign up for future vaccine clinics. How is that rolling out? What do people need to know?
Yeah, so this week we held our first open to Cordovans over 65 vaccination clinic. It went very smooth. Things seem to be going well. We were able to get 116 people immunized through this vaccination pod. Olanka is also working to get people immunized, and future vaccine allocations, we will be teaming up. Both clinics will be working together. The staff from Olanka will come to the hospital ambulance bay so that we can do a larger pod and start working to reach all the eligible members of our community that we can get vaccine to. So in order to do that, we have opened up a vaccine sign up online. We're asking people to give us this information now, even though we don't yet know our vaccine allocation numbers. We don't have a planned clinic. We would like to get this information so that we can start planning and organizing so we can deliver a very efficient and effective vaccine delivery program for Cordova.
Okay, so last time it was telephone only. This, what you're doing now with building, sort of preemptively building this database, is using both of those resources together?
Yes, so we have an online sign up, or people can continue to call to let us know that they are interested in receiving the COVID-19 vaccine when it is available and they're eligible by calling the 424-3045 number. Okay,
so not the main hospital number. Not any of the clinic numbers, but this one specific phone number.
This one specific phone number, they can call that number and leave a message, or they can get online to our online survey. The link for the form is available on the hospital website. It's available on Cordova Prepared. We're working on getting it out on flyers so people can get access to it and know that it's available throughout the community. And the Olanka and NVE will also be providing this information. As I said, we're teaming up, we're working together for these larger vaccine pods. Once we get the vaccine allocated to us, the healthcare workers in the community will be providing these larger pods. Right now, for Alaska and for Cordova, we continue to follow the state guidance. Vaccine continues to be in very limited supply. Currently, we have been able to provide and open it up to any Alaskans over age 65, healthcare workers, first responders, and long-term care residents and staff. So here in Cordova, we've been able to work to start reaching those groups. We still have a number of people that are in those groups that will still be eligible for our next allocation. And we are holding for further guidance from the state when we can open it up to the next eligible group.
Okay. And again, the state has that site that people can go to see how the tiers are going to work. And once you take care of everybody in one tier, then it can be expanded to the next and the next and the next, as the various subpopulations get their vaccine. So then, once all this data is collected and databased, then when, say, the state sends another 100 doses or 200 doses or whatever they send, you guys will already have, the medical team will already have then a list of everybody who qualifies through these different tiers and can call people?
Yes. So in the survey, we ask people to give us their first and last name, their date of birth, so we can verify the age eligibility, a good contact phone number, because we are calling to make these appointments, and it helps us significantly when we are able to reach people on the first phone call. We have a lot of phone calls to make.
Yeah.
We're asking for a contact number that they answer regularly. And then we ask for medical conditions as well as their occupation. And we have the occupation listed out in very specific groups that we anticipate to come from the CDC and the state in terms of the future eligible occupation. So we are collecting that information so that we can sort through the data, identify eligible individuals, and then we'll contact them as soon as we have a vaccine that we can give them.
Good. Well, I mean, it seems like a very good strategy, pretty straightforward, not quite, when we got this first batch on very short notice, I think you guys improvised very well, channeling everything through one phone number. And now that we know that batches are going to come in, although we don't know exactly when, to have a system now that gets people in that system and prioritized according to state guidelines, and then being able to put the calls out. It's interesting, though. It's not like people in the healthcare industry don't have a lot to do already. It seems like it's got to be challenging to suddenly become massive data managers on this additional scale.
Absolutely. So I will say any of this with the testing, with the vaccine rollout, everything that feels simple and straightforward and goes smooth for our community has had a large amount of work from our team that's working to deploy these in an easy and seamless way for Cordova. We put a lot of thought into our first vaccine pods and decided that because we were targeting a more elderly and compromised population, we wanted to only use telephone. We felt that this would be more accessible to some of our highest risk patients. And so we were very clear in wanting to only use the telephone and not have an electronic sign up at that initial vaccine. Now we are going to collect the information and have it ahead of when we get our vaccine allocation so that we can organize in a different way. I think the teams have worked very hard. I just am very happy to be working with the people here in Cordova who sometimes it feels like they've been doing this for years as we roll these new things out. And it's our first time doing it, and they're doing an excellent job.
Yeah. And then as far as the overall case count, we seem to be, as you and I are talking for this update, we seem to be on a down slope. We're down one from yesterday, one more recovery, and assuming we don't suddenly have a balloon in the upward direction, a number of these other cases should be recovered. How are you feeling about the status of spread of the virus?
I think we were all expecting some spread after the holidays and knowing that people were gathering. We certainly saw some increases in cases after holiday gatherings. We continue to see cases related to travel, whether it's people coming in from outside or people that have been outside on vacation. Travel both in-state and out-of-state seem to continue to be pretty high risk for us. So we do ask people to continue to test, continue the strict social distancing, and I think Cordova is doing that, and we should continue to see those case numbers drop. I think we're doing well.
One other thing, too, that I'm sure is going to be a real common question is more people get vaccinated. Is once one has had both vaccines, and this again takes 2 shots, do they need to continue to follow the safety protocols? And a lot of what I'm hearing from various experts that I've encountered is, for a while, being vaccinated doesn't mean you can throw your mask away and start hugging everybody again.
Yeah, so we got this vaccine out really as quick as we safely could, still following the scientific process and those protocols. But part of that means that they haven't had time to do those extra levels of investigation and study to know they were wanting to get the vaccine out to know, is this going to keep people safe, and is it safe for administration? We don't know if people can be asymptomatic carriers and still spread virus. It's just one of those questions that has not been fully evaluated yet. So we're hopeful to get some information in the next several months as more studies are completed on the vaccine. But for now, because we don't know, vaccinated individuals may be in that asymptomatic carrier state that could expose a lot of other people to risk. And I know with COVID, I think that that's certainly been one of my largest fears, and many of our fear is not necessarily getting COVID, but accidentally giving it or exposing a high-risk individual or somebody in our community to it. So we do ask people to continue to wear masks and continue to social distance until we know that we can't be asymptomatic spreaders and we're not still exposing our community.
Yeah. So it should help the person that gets vaccinated. The vaccine helps, if not prevent that individual from getting it, at least not having as severe a case. But there's no data, no good data so far on whether a vaccinated person can spread it around. So for a while, at least, we need to all expect the same protocols with hand washing and masks and social distancing and all of that to continue. Anything else? Anything interesting from the state meetings or your reading or any frequently asked questions, things like that?
I don't think so. I think everybody's watching the vaccine very closely, and the state is working very hard to make sure that they get the information out to communities. Many people probably heard recently at our city council meeting, Dr. Zink joined us, as well as some other members of her team, to talk about vaccine. They're really doing an excellent job. I think Alaska has continued to shine in our response to the COVID emergency, and I really think that has been thanks to the amazing efforts that Dr. Zink has put into this and in gathering a team of experts that have really helped us respond well. Alaska is one of the most vaccinated states. I have confidence that Cordova will continue to get access to vaccine as it becomes available, and we will get it out to our community. So
yeah,
thank you.
I was hearing that about Alaska too, that per capita, we're actually in the lead, I think right at the top of the list there, which of course could change the way things roll out, but it's certainly good news. And Doctor, again, please pass on your thanks from us here at the station, and I'm sure many in our audience who appreciate all the extraordinary work that the team is doing, that you're doing, and we sure hope you have a great weekend.
Thanks, you too.
All right. Thank you, Dr. Sanders, for that conversation. And again, as we mentioned, some pretty interesting information as far as being able to find your way to the official list for potentially getting a vaccine. Now, here are the web addresses that you'll want to know. If you want to get to the sign-up form, the Cordova Community Medical Center has a link for it right front and center, right up at the top on their website. And they are cdvcmc.com. cdvcmc.com. And then, if you want to find out about the eligibility, because Dr. Sanders talked about those state rules where we get sorted based on certain CDC criteria, that web address from the state is covidvax.alaska.gov. Once again, covidvax.alaska.gov. So those two websites, cdvcmc.com and covidvax.alaska.gov, those will provide you with the information that you need at this point to participate in the ongoing rollout of COVID vaccine. We will continue to be here for you weekdays in the 1, 5, and 8 p.m. hours on the radio, and this show goes to the YouTube channel, youtube.com/Cordova TV. I'm J.R. Lewis. Hope you have a great weekend. Thanks for listening, and we'll get back to regular programming.